Okay, so we're live. Welcome to the Magic Minds podcast. I'm Matt Burke. Today I'm joined by a special guest, Dr. Maria Frampton. How's it going, Maria Frampton?
Great, thanks. Thanks for inviting me along today, Matt.
You're more than welcome. I'm absolutely delighted to have Maria on. Maria is a doctor in psychiatry. So today's podcast is going to be about education. For anybody, like, if you're suffering with mental health difficulties, or you have a family member, or if you're an allied health professional, and you're in that industry working with disabilities and the impact of that. So we're going to cover a broad range of mental health kind of topics, and hopefully be something in that for everyone. And Maria has been in this industry a long time, so I'm hopefully going to pick her brains. We're on a suicide awareness committee together. I love her attitude towards suicide. I love her attitude towards mental health. It's normalised. And I'm just so lucky to be able to tap into this resource. So Maria, just for our listeners, give us a little background of your history into psychiatry or mental health in that industry.
Sure, yeah. So I suppose going back to my days as a medical student, one of my favourite specialties would have been psychiatry. Loved it from day one. Just enjoyed meeting people, listening to their stories, their life experiences. I went on then when I qualified to specialise in psychiatry, I suppose mainly because the first year after you qualify as a doctor you do medicine and surgery, and I was very conscious on general hospital wards that I was constantly chasing investigations, results, and when a psychiatrist was called in to see patients who were feeling depressed or suicidal, I used to envy them so much that their time that they could actually sit by the bedside and speak to a person, whereas I was running after blood tests and x-rays, and I always thought, God, I'd love to sit in on those consultations. So after that year I went into psychiatry and I did my junior training in Dublin, and then I went to London for 7 years, and London was a fantastic experience because when I left Ireland was just full of Irish people, and I arrived in East London into an Afro-Caribbean, Asian, Turkish community. So interesting.
Wow.
And I also got the opportunity to work in a HIV liaison clinic in St Bartholomew's Hospital, which was where I did my training. So at that point, just the early days of the antiretroviral drugs, so people were dying of AIDS, and that was a sort of a unique experience to work with those sort of people and share their experiences. I also got the opportunity to work in cancer care and hospice care. So I worked in head and neck cancer and breast cancer clinics in the hospital. So yeah, London was fabulous. And I worked for 3 years in London as a consultant before I came back to Ireland. So nowadays I'm here in the NRH 1 day a week, and I'm in St Vincent's Hospital in Ellen Park, 2 days working in later life psychiatry or over 65 psychiatry, and then I also do some second opinions and mental health tribunals for the Mental Health Commission. So I have a very varied week, really. It's great. I love the job, absolutely love every
Brilliant.
minute.
It's interesting that you just touched on before when you got into it. It was the human story. You like to listen to people's stories, and that's something that and it's probably the reason why I started a podcast as well. It's getting to know people at a human level, isn't it?
Yes, yeah. There's absolutely nothing like it, because you could have 100 people in a room with the same diagnosis, and for each individual they'll have a different life story or tapestry to bring to you. It's people's experiences, life experiences from early life right through their life that kind of paint the picture. And we talk about person-centred care, and it really has to be that, because no two people with the same diagnosis are the same, and you have to tailor your approach and your treatment to the individual you're working with, rather than putting people into kind of categories. And psychiatry is wonderful in that way. It allows you, it's probably an honour to be able to be part of the intimate details of people's lives. And you never, ever hear the same story twice. And you never stop being shocked and surprised by what you hear. Yeah. Every day you're hearing something.
But it should start with that basis that you want to know. You want to know another human being's story. I'm fascinated working in this industry, working with brain injury patients. I just want to hear like their life. It just it blows me over every time I hear a different story.
Sure, yeah, absolutely.
So, talk to me. The difference for people when you say psychiatry, psychology. Some people go, "Oh, psychiatry, that's the really serious one, and that's where people get locked up." Or psychology, oh, we can work that out and we can go to counsel. What's the difference?
Yeah.
Give us a difference there.
I suppose, well, psychiatrists have studied medicine, so they have a medical degree, and it's psychiatry. Although we look at the whole person, and our approach to treatment is what we call biopsychosocial. We look at the whole person. Medication is only one aspect of treatment, but we're looking at treating illness. Psychologists, I suppose, in comparison or in contrast, they treat mental and emotional disturbances using behavioural or psychotherapeutic approaches, so more talking therapy. However, there's a huge overlap. We work together, very much work together, and there's a lot of overlap in our work. That's basically it. But I suppose I wouldn't want people to think that the only difference is medication either, because I think medication is the last, for me, working with older people and working with brain injured people, medication is the last port of call. So I'm very much looking at health and lifestyle before I go down the medication route.
And any of the conference talks that I've attended with you were predominantly word that aspect, the lifestyle, the nutrition, I'll absolutely definitely agree with you there, and that's the kind of avenue you go down. As far as mental health, it seems to be everywhere right now. Everyone's talking about it all over social media. It used to be huge. Yeah. Is it really huge, or are we just more aware of it, or are we more just talking about it now? Has it always been this way, or is there an increase on it? What's your thoughts?
There's an increased awareness of mental health issues, and I mean, even from children from the day they start school, they're literally being made aware of emotional health. You have little kids in primary schools having circle time, where they go and talk about their worries or any concerns they have. In the secondary schools, you have organisations, voluntary organisations like Aware, Pieta House, going in to provide education on mental health for kids. So right throughout the lifespan now, from early on, children are learning about mental health. I mean, as it turns out, there's a lot of talk about it. So one could get the impression that the suicide rates are higher than they've ever been. The overall suicide rate, believe it or not, and this is according to the HSE National Suicide Office, the levels are actually dropping. They're higher in young men, sort of 18 to 24-year-old men. They did increase for a period of time, but overall they're dropping. And actually, teenage suicide rates in Ireland are lower than the European average.
Really?
So yeah.
I didn't know that.
The European average is about 4.7 per 100,000. We're lower than that in Ireland. Although you would think, from listening to the media, that suicide is huge in Ireland, but it's. We've had a lot of kind of anti-stigma campaigns from the College of Psychiatrists, from the Department of Health, and this is all increasing awareness and talking. So although it's in the media a lot, it's not as bad, or it's not worse than it's ever been.
It's just the awareness is heightened.
The awareness, absolutely, yeah.
And it's getting more coverage. And I suppose that's understandable, isn't it, though, with social media, Twitter, your Facebooks, there's tons and tons of groups and everyone's talking about it. Yeah. I'm just worried that, though, it's probably getting over, and, here we go again, not more mental health, or here we go again, you're always on about this. Yeah, I'm afraid it'll get to that point. What do you think? There
is a worry. I suppose there's pros and cons to everything, as there is in mental health, that I think it's important for youngsters in particular, with social media nowadays, Facebook and Instagram. Young kids seem to think that it's important to be happy all the time, and everyone is happy, and if they're having a bad day they think they must be depressed. Like my daughter came home to me a few weeks ago, and a young girl in her class had come up to her and said she was feeling sad and she thought she might be depressed. So my daughter asked me, does that mean she's going to commit suicide? Okay. So this is the way they're thinking. Yeah. If you're not happy, you have to be depressed, and if you're depressed, maybe you're suicidal.
Yeah.
So that's
a great point.
It's trying to get the balance right. Then my son, who's only 13 last year, he in 1 week he had 3 experiences of suicide. Now, when I was his age, I probably didn't even know what the word suicide meant.
Nor did I.
There was one day he was coming home from school on the Dart, and he rang me to collect him. The Dart had been stopped because somebody had thrown themselves onto the Dart on the line. Then another day he went in that week, and in their circle time, a friend prayed for his cousin who'd committed suicide. And then still later in that week, sadly, a teacher in the school committed suicide. So that was 3 direct, if you like, experience, very close to home in 1 week. And I mean, certainly, for young kids, that's, oh my God, it's excessive. So like their suicide, depression, that's all part of their language now. We didn't have that type of language at their age, so it's just that's an interesting point, the way you said that. When somebody presents with, oh, I'm feeling sad, or I'm not putting down, we straight away jump from 0 to 100. And I've had experience when my friends know that I'd had difficulties with my own mental health growing up, later on in life, and I would have said, not feeling great, but I'm really aware of how I feel and what I'm all about. But they would directly say, you're not going to do anything stupid now, are you? But they don't have that education, and I understand them, and I say, no, and I'd reassure them. Yeah. But I can imagine what it would be like for someone then to say it to someone that didn't have education, I'm not feeling great, and then they say to you, oh, you're not going to kill yourself. To put the onus on someone. So maybe we just have to kind of separate. Just because you're feeling down, yes, you're
not going to be thinking of suicide. So if anyone's out there coming and presents that to you, just listen to them. Oh yeah, absolutely. And unfortunately, there's been a few sort of teenage idols, the Amy Winehouses, and there's been a few kind of well-known people that have committed suicide. Musicians. There was a guy, just can't remember his name now. Kurt Cobain. Well, there was Kurt Cobain, but more recently, a guy, he was only 24, 25. Oh no. I can't think with put on the spot. Yeah. But you think that kind of glorifies a little bit. And it's too much on young people's radars. I suppose what people need to know is that all of us can help somebody who's feeling down. I think the biggest gift you can give to anyone is your presence and your ears, to be there for someone and to listen. Because that's all. Most people who are suicidal or talk about committing suicide, not everyone, but most, don't actually want to end their lives. They just want to end their misery. Oh, 1000%. I've heard that so many times. If you can sit down and give somebody your time, because very few of us have time nowadays, but just having somebody to talk to can make a huge difference. Just giving somebody the time and to listen. And non-judgmental. A few minutes of your time just to hear them. Whether you agree or whether it's rational or not. But just to let them unpackage it. Yeah, that's a huge and to be comfortable insight with silence, because the last thing somebody wants to hear is, oh, for God's sake, snap out of it, or look at all you have. You've got a partner and children. How would, this is a selfish thing. That's the worst thing you can say. And sometimes it's more difficult to kind of sit and say nothing. Absolutely, because especially Irish mammies or Irish people, we try to fix it. What you need to do now is you need to do this and you need to do that. And instead of just sitting and going, that's okay. And listen, valid point. Back to just something you said there earlier, just about lifestyle, nutrition, and with the mental health. Do you think antidepressants are over-prescribed? Do you think they're thrown out willy-nilly? I promise I'm not giving out about doctors and those, but do you think, is lifestyle looked at more so now, or could it be looked more so? Yeah, possibly it could be. I suppose it'd be a very broad statement to say that they're over-prescribed, because I know in my work as an old age psychiatrist, I know that depression is under-recognised and under-treated in nursing home patients. Up to 40-50% of people in nursing homes suffer from depression.
I do think that tranquilizers, hypnotics, sleeping tablets are overprescribed in that population. I also think, and again, this isn't a blanket statement, but in some situations where we've got just to clarify, the vast majority of people with depression are actually seen by their GPs or seen in general practice. So we as psychiatrists would only see the 10% most severe who are referred to us by psychiatrists. So given that the majority are seen by psychiatrists and by general practitioners, and general practitioners on average have anything from 8 to 15-minute consultations. They don't have the time to maybe talk to people in detail about their lifestyle, about their diet, about nutrition, and in some instances maybe antidepressants are too easily prescribed. It's easier to prescribe a tablet than
and having to go through the whole rigmarole. Did you sleep well last night? How was your nutrition? How was your environment?
Yeah. And when Prozac first came out, and it was kind of thought to be a kind of a wonder drug, very few side effects, safe in overdose, I suppose maybe it was seen as, a bit of a miracle drug and maybe overused. But hopefully as there's more awareness of mental health, that won't be as big an issue.
Well, I was encouraged when I do hear you speak,
yeah,
and when I hear some of the other consultants speak around supplement and pharmacological, things you could do around brain injury, and a lot of it's around nutrition, supplements, drug related supplements, food. So I do think it is changing. I think people are more aware.
Yes, absolutely,
It's not straight for the antidepressants or the prescription drugs.
Now they do, for the people that I see who are very severely depressed by the time they get to a psychiatrist, although, sleep and diet and exercise are important and talking therapies are important, somebody may be so depressed that in order to access or engage in talking therapies, they need an antidepressant.
Absolutely.
So that's
to level it off. Absolutely.
Yeah.
I promise I'm not knocking antidepressants or drugs or one shoe fits all. Absolutely not. I think there's, and plus I'm not a big advocate for going out and telling people to exercise when they're depressed either, or when they're feeling sad. Because it mightn't be something that they agree with. It mightn't be something that they like. So then I think it's another probably stick to beat themselves with.
Sure.
I think it's looking at everything. And throw in the antidepressants, throw in the sleep, throw in the environment. I think it's just it's a multi-pronged approach.
Absolutely, it is. And like to think actually 1 in 5 people in the United States are on at least one psychotropic, which is a bit kind of worrying. So seriously.
So I've also got me conspiracy theories about the big pharma effect as well.
Yeah.
Well, let's not get into that. We don't want to stand on anyone's toes.
Okay.
So what is the recommendations when somebody presents to their doctor, to their friend? So like mildly not feeling great, being down a while, it's like sad, blues, couple of weeks. What are the go-to things?
If it's early stages, somebody's feeling low, certainly the best thing they can do is to speak to friends, family, colleagues, just to have somebody that's there to listen to them. What can be helpful is we've a huge volume of self-help books on the market now. So there are some really good literature that people can access. For younger people, they often like to go online and do online counselling, even, or online therapy, or like voluntary organisations like Aware, Samaritans, Pieta House,
Jigsaw.
Jigsaw, Headspace, the HSE, yourmentalhealth.ie. All of these things can be really helpful.
Great resources.
Fantastic, yeah. So, not to medicalise things too soon.
Okay, that's a great point.
When it moves on from that and they start feeling that their mood becomes pervasively low and their quality of life starts to suffer, i.e. their social relationships, their ability to get up and go to work, things like that, they may need at that point to go and see their GP. And then if the GPs can mostly handle depression, mild to moderate depression. In the case of somebody becoming severely depressed and suicidal, starting to neglect themselves, they'll need to be referred to their local community mental health team or psychiatric services. But it should be a tiered approach. You start just speaking to friends, looking at the whole self-help literature, engaging with online or telephone help. And then after that, you go down the medical route, I would say.
Yeah. I think that's a great point. The tiered approach.
Yeah.
And I like the way he explained these are the first few weeks, and then when it gets progressively worse. But I think but sometimes we have to be careful with family members to try to push you straight away. Oh no, you need to get something. The doctor might be able to get, and we plant that seed. But I like what you said earlier. Stop, listen, give them a space. Yeah. And then that approach, take it easy. Yeah. And we try to rush it right to the end and go straight on to to fix it.
Absolutely, because I suppose the last thing that somebody who's feeling very down needs is advice. You know, in some ways,
especially
it's just
unqualified.
Yeah,
and
absolutely.
People, and family members do say things with the greatest intention, and I understand that. But just be careful the advice you give.
Sure, absolutely, yeah.
An interesting report I read, I think it was in America, it stated that 300 doctors a year in America die by suicide. That's quite alarming. Yeah. What's your thoughts on that?
Yeah, and it's even, there's one physician death in America every day. So it's more than, it's 300 plus. And it's, I was at a talk recently on burnout by a cardiologist, Paddy Barrett, who was working in the States, and his kind of area of special interest now is burnout. And how it arose was he was going in as a cardiologist into a cath lab one day, and there had been 2 suicides in July in his hospital. Doctors throwing themselves from a height, from a floor, a very high floor. And he commented to a colleague, you know, this is the 2nd suicide this week. And the colleague said, it's that time of year again. And he was just appalled and shocked that this was
the norm.
This was the norm.
What was the time of the year?
What was the changeover, when doctors change over and are getting used to a new system of working. The long hours, the sleep deprivation, the stresses of litigation, the competitiveness of getting jobs, getting residencies. In the States, they have too many doctors for residencies. Unlike ourselves here, we can't recruit. So there's huge competition and huge pressure. And then the medical licensing authorities in the States insist that you comment or if you've had a previous history of mental illness or a current history. So there's huge stress on people. So yeah, he was just making the point that the suicide rate is really, really high amongst doctors. Really, really high.
What can we learn from that?
I suppose, I mean, the other thing, doctors are dreadful at seeking help. You know, as doctors, we tend to treat ourselves. And it's very hard for a doctor. Most doctors don't have a GP. It's hard as a doctor to go to a doctor and say that you're not coping. It's really, really hard.
Unbelievable. And I can relate to that, as I'm in the fitness industry. And at times I put on a bit of weight. You know, and it's down to poor eating. Yeah. Where I would benefit from going speaking to someone else, but I'm not going to let I have before, let me ego, I should know all this, but applying it and looking after yourself, we just don't do it, do we? Yeah, no. And it's very hard for doctors to take on doctors as patients, because you have to treat a colleague as a patient if you're a patient, but it just becomes very difficult. The therapeutic rapport, the relationship, it can be difficult. The other thing, I suppose, in training, when doctors are training, the jobs are very transient. So doctors tend to move every 6 months or every year. So then it's difficult to kind of have ongoing mentorship, and we're very poor at supporting one another. And actually, when I do the teaching here in the NRH for the junior doctors, I will always say, look,
always look out for one another, and if one of your colleagues is going through a difficult time, or what's really difficult for doctors is judgment, being investigated if you make an error or, any mistakes made.
The litigation, is it?
Yeah,
your
really
career.
difficult. Yeah.
Wow.
So just, be conscious of the fact that people are under pressure at times, and just be there for one another, because they are the greatest support for each other.
So then they be more worried about if they see, I've got cracks in my arm, or there's a likely chance I'll make a mistake and that. So I'm hardly going to go and tell them I'm not feeling great.
Yeah, no, absolutely.
Wow.
And it's very difficult for people to go to occupational health or to go to consultants, because you're concerned about breaches of confidentiality. And once you have a history of mental health issues, will you be treated differently? And
if anything goes wrong, they go, maybe didn't get it. Whoa.
Yeah, so it's difficult. Yeah.
Jesus.
Yeah.
So, talk to me about suicide rates in Ireland. As we just said earlier, you're saying, and you said this to me at a meeting that we were at recently, that they are going down, and I was taken back with that because I'm led by what I see on social media.
Yeah.
But they are going down.
This is the HSE National Office for Suicide. We're hearing a lot more about it, and I suppose there are about 590 up to 600 suicides a year are reported statistically, but we know that there are probably more than that that go. They're reported as unknown cause of death or death by natural causes. So it's there's a very high threshold for reporting somebody's death by suicide. In the past, it was very stigmatised, and we spoke about people committing suicide, which made it was a crime. And using that word commit has, it makes it sound like a crime, whereas nowadays we talk about death by suicide. Suicide rates are undoubtedly falling, though they have in recent years they had risen in young men in that particular group, in the sort of 16, 18 to 24-year-olds.
It's the second highest killer in road traffic accidents in young men, apparently.
Yeah. And very often in the context of impulsivity. And we know that over 50% of suicides once the coroner's report comes out, because we have post-mortems when the cause of death is unknown, often that over 50% of people who commit suicide have a substance, be it alcohol or some other substance on board, which makes us think that it's an impulsive act, rather than a planned act. And a significant proportion of people that do go on to complete suicide don't actually have mental illness. So it's not all in the context of mental illness. It may be impulsivity. And we do see clusters as well. You would just think it was an isolated incident and just went, look, I've enough of this. And maybe. Though we do know that a significant proportion of people also who commit suicide have spoken to somebody about it in the weeks or months preceding that, or who have been to their GPs. Yeah, I recently done an interview with a young traveller woman, Eileen Flynn, and she laid one on me that traveller men are 7 times more likely to die by suicide than settled population. Is that news to you? Have you heard of that? I have, and I suppose travellers are at a social disadvantage from the day they're born. They have really difficult lives in that they have difficulty accessing education, they've difficulty getting their kids into school, and they've low educational attainment, which means they have low employment rates, which means then they have difficulty with accommodation. There's high levels of homelessness. There's higher levels of alcohol and drug abuse than the general population. Absolutely. Which in itself would increase risks or rates of mental illness and suicide. I'm glad to say that just hearing recently that traveller history, the history of travellers in Ireland and traveller culture is going to be introduced to the national curriculum in schools. That's something to do with Eileen Flynn. She's been on the board of that. They've been working on it with the traveller group. Yeah, I just interviewed her last. She's
show number 13.
Okay.
And they just got that passed. So I was absolutely delighted. And what you just said there a minute ago about the housing, society, we touched on all that. And it's at all that level, like from the day they're born, that they're not accepted by society.
Yes, yeah.
It doesn't surprise me now that it's 7%. I'm not surprised. I'd be thinking it'd be higher.
Yes, yeah. And even there's a lot of feuding amongst travellers again, and there's a lot of status in the traveller community, a lot of status issues. But I suppose Pavy Point, then, the social advocacy group for travellers, has helped make us all more aware. I think as the psychiatric services fail travellers as well in a number of ways. You know, we
I think a lot of service do. There's some of the stuff that she revealed to me. I was embarrassed, you know, as a settled person, as a human being, to sit and hear her story, sit with another human being, to hear her struggle was mind blowing. Just the things that we take for granted in life that they have to fight for. Getting washed by school teachers, put in a separate line, to normal people, as they were called.
Sure,
You can really understand why the suicide rate is high, isn't it?
Oh, yeah, absolutely.
And she said to me as well, there was only one woman that she knew in Ireland, I don't think she was related to a family member, she lived in England, that was gay. She was a lesbian.
Yeah.
So that's not even talked about. Like,
but they're not allowed to admit, are they, that they're...
To just find it hard. She said there's more men than there's women.
Yeah.
I was very surprised at that. I thought there'd be more women than men, but women are just... She said there's only one. That must be really difficult, mustn't it?
Very difficult. And I read recently where traveller men who are gay are kind of married off at a younger age to try and prevent them coming out. It's all covered up because homosexuality in the traveller community is not accepted.
It's hard enough just even in settled society, isn't it?
Yes, it is. Yeah, absolutely.
Well, it's getting better, and it's, you know, we've great movement on it. Just to go back a little bit, and just in relation to what we were talking about earlier about the doctrinal vicarious trauma. What's your thoughts on it?
Gosh, I think it's very, very difficult for healthcare workers who are maybe not directly in the line of physical violence. I know some of them can be working in A&E departments and in psychiatry in particular, but just in somewhere like the NRH, where you're seeing people coming in situations that aren't going to change, like chronic disability, chronic physical ill health, and the sense of powerlessness that comes with that you know that there isn't anything significant that you're going to be able to do probably to change their life circumstances. That's really, really difficult. Apparently the most difficult situations for people to handle in terms of vicarious trauma are sick children, or sick children certainly, sexual violence, and people who have injuries from fires are meant to be the most traumatic for healthcare workers. But yeah, I think caring for people day in, day out, where you're not seeing a huge change in the sense of powerlessness that comes from that for you as a worker, is difficult to handle. So
what I'm trying to hope, and why I ask you, is that people recognise it, that just because you're not feeling it, that subconsciously it does have an impact on you. So it's like anything, you have to look after yourself, and people need to be mindful of that, don't they? Just because it's not tangibly affecting you, there is an impact. Yeah, no, absolutely. And I'm just reminded of Carl Jung, who wrote a book called The Wounded Healer, and he said I like his work. A doctor is effective only when he's affected, and only the wounded physician heals. So he speaks about, we can only, if we're not affected by the people we're treating, you know, surely we can't be of great help to them. That you know, you can only understand so poignant where people are coming from if you can feel their pain. Yeah, you know, and even if your work is demanding, no matter how demanding it is, if there's some kind of reward, and be that even a patient sort of having a good day or being able to sort of smile through adversity, that's enough to kind of
prevent you burning out maybe, or we talk about burnout and compassion fatigue when we're dealing with the hardship of other people.
Absolutely. And I just, like, people think, when you hear of other people working in offices, I've got to meet a deadline at the end of the month, and it's stress. I think healthcare workers carry that same load, but then you've got the emotional vicarious trauma on top of that.
Yes,
so you really have to be mindful of that.
Oh yeah,
and look after themselves.
Yeah.
So what do we do to support that? What supports should people be provided with? Or
there are informal and formal supports. I suppose you could divide them into, and the informal would be the C&C, so colleagues and coffee rooms. So that the most beneficial support is always your friends and colleagues. They're the people you can open up to, and they'll best support you. They know you best. And being able to go down to the coffee shop and chat to somebody after having a difficult morning, that's probably more important and more valuable than going to somebody, in a formal situation.
Yeah. And it could only take a couple of minutes just to offload.
Absolutely. Yeah. I suppose one things that doctors have would be peer groups or peer support groups.
As in like supervision?
Yeah, well, our peer group, for example, I'm involved in a peer group, but it's all retired psychiatrists, as it turns out, and we meet just 4 times a year. And it's as much to keep up to date on continuing professional development, educational activities, as it is to support one another with clinical cases. So that's not supervision as stuff as such. It's more supporting each other. But then there would be mentoring, where you have it could be a senior colleague as a junior doctor, or just a friend. But mentoring has its limits, because I think as a junior doctor, a lot of junior doctors, again for confidentiality reasons and for your own self-esteem, you're not going to want to bear all your weaknesses in front of a colleague, who's going to be writing. And
you're career driven at that point.
Exactly, yeah. There's occupational health, but again, in your own hospital, you're not necessarily going to want to go to occupational health too easily and bare your soul because it's seen as maybe weak. Yeah. Now, not everybody feels that way, but I know.
But these are the pitfalls that people might need to be thinking about.
Yeah.
In fairness, we're very lucky here in the National Rehab. We have an amazing Occ Health, which I have used over the years, and I've always felt that I've got like the same support as everyone else. When we have a unique, without sounding cheesy, I think the whole hospital's like that. I think this is a great environment to work.
It is, yeah. It's the most amazing environment I've ever worked in. It's very different to anywhere else I've worked. I suppose, firstly, a lot of the staff have been here 20, 30 years. There's so many retirements, whereas in other HSE environments, you're working with agency staff a lot of the time, or they don't retain staff.
That must be difficult, mustn't it, for them as well, like agency staff, for support.
Very difficult.
Continual care, or, continuity of care for yourself.
That
must be difficult.
And you don't have the collegiality or the colleague support like you do have here.
The rapport then with someone, get to know you, because I've often come in here and someone say, "You all right?"
Yeah,
like, yeah. And they go, "No, you're not." And they know you, and vice versa. I've often come in and says, "You're not feeling great today, eh?" And they went, "Actually, I'm not. How did you know?" I said, "Just know."
Yes, yeah. And I think absolutely, and I think the mix of therapists, the interdisciplinary approach, where you've got so many different therapists working with one person, that mix is fantastic. Everyone has a different approach to even self-care.
Yeah.
And caring for one another, and that's brilliant.
When I first came here, I used to find, and when I used to teach the boot camps, I found it was very speechies here, physios here, and they all had their disciplines, and it wasn't really mixed and matched. It was all right, they're over there and we're over here.
Yes.
But that has changed a lot over the last couple of years. I don't know if that's because of the recession, or we're hiring and it's all moving again, and the buds are blossoming on the trees.
Yeah.
But there's a great vibe, and I think that we're more interwoven within each other in the hospital.
Yes, absolutely. Yeah. No, people are very positive, and everybody is very much for the patient and for improving people's quality of life. And I think everybody that comes in here from a patient perspective gains something.
Yeah.
It's amazing.
I have to say a shout out to the healthcare workers, the HCAs up
the
in the wards.
HCAs, yeah.
Jeannie Mac. I've done interviews with patients, and we've talked about mental health, we've talked about mood and all sorts of things, and they rave about the HCAs. The care and the attitude, the crack that they have with them. You know, they just make life in the NIH a lot easier for them.
Yes, yeah, no, and I've been in the same situation that very often the people I'm seeing will identify a particular HCA as somebody they've gotten very close to. And I suppose the HCAs are in a unique position in that they're not delivering any bad news or you know, they're there to attend to personal care needs, to have, you know, nice, pleasant, light conversations with people. They don't have to do any of the heavy psychological stuff. But yet they have really fantastic close relationships with patients. And patients frequently unburden themselves with the HCAs and feel very safe. And feel unjudged. They find it easier. So it's they're fantastic.
They're a vital cog in a wheel. Absolutely. So what does Dr. Maria Frampton do to look after mental health? How do you look after your vicarious trauma?
Well, I'm very lucky in that I have a personal psychiatrist on tap 24/7 because my husband, my husband is a psychiatrist. That's really handy. No, but
is it though? Is it handy or can it be difficult for both of you?
I know it's good. It's much more advantageous than it's great actually, because we can both kind of bounce things off one another when we're talking about our days, and it's great actually. It's really helpful to get different perspectives on things. I love the sea. Absolutely love the sea. So I love swimming and sailing and going for walks by the sea, and I meditate. So I did a year-long meditation course in the College of Physicians for healthcare workers. Just about 3 years ago. And I think it's probably the thing that's had most impact on my life since. I'm a huge fan of and mantra meditation. So kind of deeper than mindfulness, if you like. So
talk to me a little bit more about that. What?
So I would try and, I haven't been great of late since the kids got their summer holidays, but I would try and start each day with 20 minutes of meditation in the morning before I start the day. And if I do that, the day is just amazing. Yeah, you're just... So
is that like mantras and you pick a word, or you're given a certain mantra?
You choose a word and you just... I sit in the same place in a particular chair in the house every day, and it's a quiet spot that I've chosen. It's my routine. And
is that transcendental meditation?
Not as deep as transcendental. I suppose it's in between mindfulness and transcendental. So you just repeat this word, and the word just stops you. And I mean, it
doesn't have any relevance to anything. It's not like you pick a word that's going to make you think about your ex-boyfriend or your ex-girlfriend. It'll just be a meaningless word.
Maranatha is the word we used on the and it's Aramaic for "Come, Lord." Is the word,
that's interesting.
And we just repeat that. And what I'd say is it's a simple process, but it's not easy. It's very difficult. Like, you never stop learning, or you can never improve your meditation enough. There are mornings when my thoughts are just all over the place.
Your monkey mind.
Yeah. And then other days when it's a bit better. But the mantra brings you back. So when you're wandering, you just keep coming back to the mantra. And you set an alarm and you do your 20 minutes, and it's...
I love meditation, but the only thing is with meditation is I'll do it and then I feel I'm great and I'm like, that's grand, enough of that stuff, off I go. I go, why didn't I just stick to that? You know, because it really works. I follow a guy, a Buddha leader, Jack Arnfield. And it's
Cornfield?
Yeah.
Oh, yeah.
I love the love and kindness meditation.
Oh, yes, yeah.
And I do it and I love it. I'm really into it and it gives me the warm, fuzzy feeling.
Yeah.
And then I stop and go, it's all grand now. And then I go, I should have stuck with that. So...
Yeah.
So you were saying to be consistent with it?
Yeah. It's if you can make it, I think you should ideally do it twice a day, morning and evening.
Right.
But even if you can start the day with it, it does set you up for being more considered and more reflective during the day. So when things get stressful or things are coming at you, instead of reacting, I think you just become more considered and you're more chilled out. But then there are days like when I lose the cool with the kids and I think, oh my God, I've meditated. I shouldn't, I'm pathetic. Like, why hasn't this lasted in the day? I just hate myself for it. So we're all only human.
Yeah.
So you do the best you can.
So you do meditation. Are you an exerciser?
Yeah. I would have been probably more when I had more time in my younger days, but I try and ideally, I suppose exercise is hugely important to me. I have to be doing something most days, even if it's just a walk. It's a great de-stressor. It's just something small. If it's a 20-minute walk, or I tried to swim, but there was a time when I'd swim every morning before work. Now I'm lucky if I get to swim twice a week.
Oh yeah.
But
do you
so
in the
water
sea, in the sea, like
in the sea in the summer, and then in the pool in the winter. And the water just transforms you. I think you just feel great when you come out. Yeah,
I've been threatening to go up to the 40-foot for probably maybe the last 4 years just to jump in.
Oh yeah.
I'm interested. I read a lot on heat shock proteins and cold water submersion.
Yeah,
I just don't have the bottle to get in and jump in.
You have to do it with somebody.
Oh, and I hear there's jellyfish up there.
There are. I don't like jellyfish.
Lion's mane jellyfish or something. I was like, no, I'm definitely not going up there. I'm too precious for that. Carry on.
I know.
So you love your meditation. You love to be physically active.
Yeah.
And just starting your day right.
Oh yeah, makes a big difference. Like actually getting up, giving yourself enough time in the morning. If you can get up before everyone else in the house and make yourself a cup of tea or coffee and just chillax before the house comes alive, that makes such a difference, rather than sleeping it out and rushing and running out the door. It's just really setting your mind up for the day.
And they're all free things that you just said. They cost nothing.
Yeah.
Being physically active, meditating, your mindset.
A gratitude diary is a really good thing.
I love it.
Yeah.
I just think it's great.
No, just even 3 reasons for thankfulness or joy or whatever you want to call it. And
I always say to people, do it. Think of something that you're really grateful for.
Yeah.
And they think, I said, how do you feel? I feel actually good. And think of something that you really don't like. How does that make you feel? And they go, oh, you don't like that. Then do the other thing, because that really is good for you. Like, think of the things that you're really grateful for.
Yeah.
You just feel good, don't you?
Yeah, no, absolutely. And even it can be something very small, like that you got up and had breakfast today, because when people are depressed, like getting out of the bed is a huge achievement, and having a breakfast or having a shower is a huge achievement. So just tiny things. I tell people tiny things, or the fact that you said hello to somebody in passing in the corridor. When you're having a bad day, you might just look at the ground and find it difficult to meet somebody's eyes, but just small things are so important, so that in a week or two's time, when you're having a really bad day, to look back over the diary and think, gosh, this time last week I was able to do this, this and this, and I know that in the next day or two I'll be back there again. So it's just small things. And
sometimes we get caught up in the day going, oh, it's all so bad. But if you sat down and said, what did I actually do over the last week? You might have exercised a couple of times, you might have went for drinks for a few people, you might have done it, and you go, oh no, actually it's been actually a good week in comparison to this bad day.
Yes,
and be grateful for that.
Yeah, absolutely.
What books do you read? Are you a book reader? I love books.
I have a little stash, a permanent stash beside my bed, which includes, I suppose, Alan Cohen, which is a daily dose of sanity, would be one of his popular books. It's kind of daily inspirations, and Deep Breath of Life is another one of his.
Alan Cohen.
Right. And then I'd have The Wisdom of Sundays, Oprah Winfrey.
No, definitely. I like Oprah.
They're again inspirational conversations. So it's Oprah having conversations with people like Deepak Chopra, Brené Brown, Jack
love
Canfield.
Brené Brown.
Okay.
The
Maya
power
Angelou.
The Power of Vulnerability.
Yeah.
I've read that book. I've read a few of her books.
Yeah.
Cracking.
So I love reading kind of inspirational stuff. I'll always have Jack Canfield and Wayne Dyer by the
Jack Cornfield, is that?
There's a Jack Canfield.
Oh, right,
and
okay.
Jack Canfield is Chicken Soup for the Soul. And have you heard of the Chicken Soup for the Soul series?
Yeah, somebody bought me that for holidays and I brought it away, but never read it.
Yeah.
I have it in my house somewhere.
There's a whole series of them, but I've read Jack Cornfield is great as well.
Yeah.
I'm reading at the moment The Storyteller's Secret by Carmine Gallo. He's a guy that he basically talks about a good story can bring passion to performance. Like that, he talks about how leaders bring passion to their conversations, to their performance. He talks about he wrote Talk Like Ted. So he's written about a lot of the TED. Do you know the TED speeches?
Talks?
TED Talks. Yeah. So that the Storyteller's Secret is 50 different stories from different people who've literally come from the drains and great personal stories of people who've just turned their lives around, and really inspirational and very insightful. So I kind of like that type of thing.
I'm delighted that you actually said that inspiring. You read and watch inspiration things, because I've said to some before, I love the whole inspiration thing. It's a bit like word porn now, isn't it? It's just overused. And I'm like, no.
But you take from it what you want.
Absolutely.
You know, some of the stuff is very...
Some can be a bit cheesy.
Fluffy.
Fluffy,
But and there's another guy, he's a psychotherapist, Irvin Yalom. Irvin Yalom, and he talks about life's two greatest challenges being that, firstly, that we all must die, and secondly, that each of us is responsible for leading a life worth living.
Okay.
And he's a whole load of books, and in each book he talks about cases as a psychotherapist, people that he's met during the course of his work, and the stories are fantastic.
Yeah.
So I've read nearly all of his book. They're books, you see, that you can put down and pick up. I can't during the year. Just life is so busy that I can't easily get into a book. But if I could put something down, I'll have a few on the go.
I have a few on the go because I like educational stuff, I like motivational stuff, and I'll probably have
the
3
light
books.
Stuff.
Yeah.
So
and
the
then
light
I'm watching
stuff.
things too.
Yeah.
I'm a visual as well as a reader. Yeah, that's savage. So. Okay, what's the one thing from this interview that you'd like people to take away?
Okay, I would say that the most valuable gift that you can give to anyone is your presence and your listening. That mental health problems aren't necessarily on the increase, but there is an increased awareness of mental ill health and good mental health. Every one of us can help somebody who's going through a difficult patch, and to allow, if you yourself are having a difficult time, to talk to somebody. Always find someone to talk to. Social contacts and social interactions can really protect your mental health and promote good mental health. So talking is really important. If you're on the other side and somebody comes to you, just being there for the person, maybe saying nothing but just listening, is probably the most important thing that you can do. There's more talk and more openness and more awareness of mental health, but it doesn't mean that problems are increasing. It just means that we're more aware and there's more education around mental health in society these days. Brilliant.
That is absolutely fantastic. Right, well, I think we've come to a close, unless you want to share any more
No. That's,
pearls of wisdom with me.
I think we've covered a broad range of topics.
When we were talking, you were saying like maybe we just talk about suicide, but I just think there's so much out there. It's not. I don't want it to be just all about suicide. Suicide is like, it's like the end product, not an end product. But I mean, we want to try help people before they get there, but not just the person. Like when you're dealing with brain injury, the family are so important. Even the people that are not suffering the mental health, the health, they need to be educated. They need to know what to do. And just, you nailed it on the head there. Listening, sitting, not sitting there waiting to reload. When they say this, I'll say this. When they say this, I'll say. Just sit and listen.
Yes,
listen. Non-judgmental. And just make it normal. And I think when we've been at meetings, when you talked about suicide, it just seems normal. I know people mightn't like that, but it's part of life. Absolutely. And it is preventable.
Yeah. And rather than, it's easier said than done, I suppose. As a mental health professional, you're used to being around people who are suicidal, but so not being patronising. But when somebody starts talking about suicide, to actually, as you say, stop and listen rather than panicking and trying to ring emergency services, because in the time that it takes you to get somebody to answer the phone on the other end, that 5-minute conversation may be enough to make the person change their mind or to calm them down, because we all have something to give when somebody's in distress. It doesn't have to be a professional. It just has to be kindness and an ear.
Absolutely, you don't have to be qualified to be able to listen to someone.
Yeah.
Okay, brilliant. Well, thanks very much, Maria Frampton, for coming in to join us.
And thank you, Matt, for inviting me.
I'm delighted. Thanks a lot, guys. Okay, so there you go. There's another absolutely fantastic interview wrapped up. That was brilliant. I suppose I'm just a little bit mindful. I hope I didn't talk too much. As Maria said, it's good to listen, and it's generally what I try to do all through the podcast. It's not about me. It's about the guests that I have on, whether to professionals or whether they're people coming along to tell a story. I like to give them the space. I like to give them the opportunity to talk and me to just to listen. But to have somebody on of Maria's calibre, it was very hard to contain myself not to talk, because I just wanted to sit there and have the chats, discuss, listen, talk, throw my point in. But I forgot I was in an interview sometimes. I just had to pull myself back and rein myself in. But I loved it, and some of the pearls of wisdom that she dropped and the insights that she shared. She's in this industry a long time. She's been a professional a long time, and it just oozes over, and it's brilliant. She's great company to be in, and the good thing about Maria, as I say, I'm on a committee with her, the Suicide Awareness Committee in the National Rehabilitation Hospital. The great thing about Maria is you meet the person first before you meet the professional doctor, and that's what I love about her, and I'm sure that's what patients love about her, is that you meet her on a personal level, and then she's got the tons and tons of qualifications and professionalism. And that's very similar to Maeve Nolan also, that works in the National Rehabilitation Hospital. She's the same. You meet the person first, then you meet the qualification. You meet her as a professional, and that's how I think you build, well, in my opinion, is how you build a good therapeutic rapport with your clinical psychologist or your psychiatrist, and I've met some psychiatrists and consultants over the years, and it's like talking to a textbook, the personality of a wet fish, and I would find that hard to build a therapeutic rapport with, and it's great. And as Maria says from the very get-go, was that she loves to hear people's stories, and that comes across when you meet her. She's genuine, authentic, and the same with Maeve Nolan, the clinical psychologist. It's great opportunity to have the two people work so close to me, and then to get them on the podcast, to get somebody of that calibre, or herself and Maeve, to get those two people on the podcast. It's just fantastic. And some of the insights that Maeve and Dr. Maria Frampton shared was just brilliant. It was all very simplistic, whether you're only starting off and you're feeling down, depressed, or anxiety has only kicked in, just great tips in that interview, and looking after yourself, whether it's nutrition, whether it's exercise, and whether it's, finding something that you're passionate about. And then if that doesn't work, go to the doctor, seek professional help. But there's so many steps before that. Speaking to a friend, or if you're the person that's somebody has come to you, finding a space and listening to them and giving them their voice so they can be heard, and you can save a lot of time and heartache by going to the doctor or whatever, by just listening to a person. So that was a fantastic interview, fantastic. And we got together with Maria for that interview in hope in September for Suicide Awareness Day that we're going to release a show. So I'm going to take snippets from this interview, Maeve Nolan's interview, some previous patients that have had suicidal thoughts or experience attempts at suicide. We'll bring you some of that and make a show out of it and raise awareness. We're going to aim it for, healthcare professionals, but also for anyone, any Joe Soap. We're hoping to release it in the hospitals. Staff members can have a quick listen to it if they can't make some of the talks that we're doing on the day. We generally do a suicide awareness day in the hospital to raise awareness for staff and patients. So hopefully September we'll have a show out that will have snippets from each professional and patient. So I'm really looking forward to that. It's an area that I'm really passionate about. As I've had struggles myself with my own mental health. So I love to hear that awareness is being built around it, and it's just making it normal, the same as suicide, making it normal. Not saying that it's acceptable, but that it's okay to talk about it. And you can talk about it, people will feel that, I can actually tell someone about this. And when somebody, as Maria said during it, just when somebody comes to you and tells you they're sad, down, depressed, or feeling blue, it doesn't always mean that they want to die by suicide, But some people get the fear when they hear, and that's they think the worst possible scenario. But it's about listening to the person and understanding it and getting them help. So hopefully this show and any of the stuff that we do over the next coming months, or the Suicide Awareness Day, will raise awareness or make this an easier topic to talk about. I find it easier to talk about, but I'm around this kind of industry and it's normal to me, and I don't expect people to find it normal right now, but hopefully in time that's the kind of level of acceptance that we have, that it's okay to talk about. Same with suicide and any kind of mental health, whether that's depression, anxiety, schizophrenia, anything, that it all becomes normalised and people find it easier, and we can save lives, and that's what it's all about. So hopefully you got a lot from that, because I certainly did, from a personal and professional point of view. So that's all we have time for. Show is, as always, I'll thank Niall Riley from Rooney Media. So any graphic design needs, check those dudes out. Check him out. He's my main man. He's my best mate. He does great work, and he's always helped me in the podcast. Thanks a lot, Naylor. Carolyn Harvey from ISA Nutrition. So if you have any nutritional needs, weight management, maintenance, just optimum health. Also, she's a female competitor in physique, masters physique. So anyone interested in training, females, males, sports, anything, just get in touch with her. She's on Facebook, she's on Twitter, she's also on Instagram. Check her out. She's got a great approach, great attitude. She's a good person, and she's just sound. Me team, Aaron Kyo, thanks a lot, lads. You're doing tremendous work. Really, really making the show professional. Thanks a lot, lads. So that's really it. As always, I like to finish up with just mind yourself. Be compassionate to you, and then you can be compassionate to the world. I promise you, if you're kind to yourself and you give yourself a break and give yourself internal hugs and recognise the good that you do, you will look and react to the world in a different way. I promise you that, as I know that from experience. I know that from talking to the likes of Maria Frampton, Maeve Nolan, and all the other professionals that I work with, all the great people in the National Rehabilitation Hospital. This podcast is not part of the National Rehabilitation Hospital. You'll probably hear me talk about it. This is my own gig, but it is a big part of my life, and it's somewhere that I really love working, and it does a lot for me personally and professionally. So I always try to give it a shout, because there's amazing staff out there. I've built some great friendships. Also, a lot of the people in the hospital have supported this podcast, not directly helped me build it, but give me encouragement and, champion the show, talked about it, spread the word. So I also have to thank them, actually. That's just at the coming onto my mind there. They have given me a lot of support, not directly, but I'm actually saying, giving me good feedback, telling people about it. So thanks a lot. Thanks a lot to the people in the National Rehabilitation Hospital, specifically me PWAG members and the Suicide Awareness Committee. Thanks a lot, guys. You know who you are. So that's it for today, really. So wherever you're in the world, look after yourself. Give yourself eternal hugs as always. Take it easy. Bye-bye.